Hi everyone, this is Dan Paulus, Senior Customer Marketing Manager at HealthStream, and I recently had an opportunity to talk with Kevin O'Hara, our Senior Vice President of Platform Solutions here at HealthStream, about interoperability. He had some fascinating insights to share. Kevin, thanks so much for joining us today. Glad to talk to you about this subject. You are the Senior Vice President here of Platform Solutions at HealthStream, so tell us a little bit about what that involves and how you got brought back to take on this big challenge.
Sure. Yeah, I'd been at HealthStream for 10 years and then was gone for about 9 years running a small surgical analytics company, but had always been interested in coming back to HealthStream and helping build out what we would call our platform. And, we're in 70% of hospitals around the country. And so that opportunity to help other companies build their products, build their businesses on top of that presence was always very compelling for the company. And so what I'm responsible for in Platform Solutions is helping to build out that technology platform that underlies not only our products, but allows our partners and others to build products on top of that. And to take away some of the work that they have to do to get started and really can just focus on the areas that they're specializing in and just build on top of that and get all of the kind of basic infrastructure that you need to distribute products into hospitals.
All right, sounds exciting. I've heard this term interoperability, so I want you to break it down for me and whoever's watching our conversation. What is it and why is it so important?
Sure, yeah, great question. And it really comes out of that platform notion. And so there's really two ways that we think about interoperability. One is interoperability between systems. And so if you think about our own applications and partner applications and then third-party applications that exist in the hospital, it's enabling those systems to talk to each other. And lots of standards have developed over time that have made that easier. So otherwise you have translation issues. So what my system thinks about a person and what a person's identity is might be different in another system. And so you have to have ways for these systems to talk to each other. And the way that they do that in a more modern way today is via APIs, which are application programming interfaces. And even though you have these APIs and there's standard methods for APIs, you still have to have the kind of the taxonomy, the language underneath that to work together. And so that's really the second layer of it. And so it's systems talking to each other, and then it's what they're talking about. And one of the things that we're really focused on is talking about the same person no matter what system they're in. And so we think about interoperability at the person level. So we have within HealthStream 10 or more applications that we own. And each of those applications has an idea about who Dan is, for instance. And we need all of that to be consistent. So we want to know that Dan Paulus in one system is the same Dan Paulus in another system. And getting to a unique identifier for everyone in all of our systems, and really ultimately for everyone who works in healthcare, is a key focus of ours. And so that way we can exchange data about those individuals and make it much easier for them to be doing what they're really meant to do, which is to deliver care, and not have to spend as much time dealing with paperwork or re-entering data the next time. And so you'll see that manifest in that individual having a portfolio that covers everything they've done across our entire ecosystem. But fundamentally, the interoperability element of that is knowing that Dan is Dan no matter what system they're in, and then extending that to partners and others as well, so that they can talk to us about the same Dan, and we know it's you, and we can pull all of that data together.